It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I talked about having a loved one critically ill in intensive care on your terms. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to talk to you about how to make meaning when your loved one is critically ill in intensive care. Before I get into today's topic, I want to share a quote with you that I wrote on today's topic, and the quote says, "The problem is never what happens to us in our lives, but the meanings we choose to give to the circumstances of our lives." Over the course of our lifetime, we are going to experience countless failures, setbacks, and things happening to us which are unwanted and unexpected. How we face our problems and challenges, and whether or not we choose to transcend them into a higher meaning or let them derail our hopes and dreams, is what separates successful people from those who live a life that is less than what they are capable of living. Successful people decide ahead of time they will look for the gift and blessing in every situation to help them improve and become a better version of themselves. So, let's get into today's topic. When you're having a loved one critically ill in intensive care, the last thing on your mind is usually to make meaning out of the situation and challenge. If you are doing what 99% of the families of critically ill patients in intensive care are doing, you'll make no informed decisions, you'll have no peace of mind, no power, no control, and no influence. However, in order to make informed decisions, get peace of mind, control, power, and influence quickly, you need to very quickly take a very different approach to the 99% of the families of critically ill patients in intensive care who make no informed decisions, have no peace of mind, no control, no power, and no influence. You see, I can hear you say, "How should I make meaning in such a difficult situation where my loved one is in intensive care and we don't know what tomorrow or even the next few hours have in store?" I hear you loud and clearly. That's what 99% of the families of critically ill patients in intensive care do and say, and as a result of that, they feel victimized and therefore make no informed decisions. They have no peace of mind, no power, no control, and no influence. They have chosen to be a victim of their circumstances, and therefore they are stuck in a rut, and it's getting them nowhere. The few families of critically ill patients in intensive care who make informed decisions, who get peace of mind, have power, have control, and have influence, all make a crucial mindset shift when it comes to one of their loved ones being critically ill in intensive care. They all consciously choose to give this once-in-a-lifetime challenge and difficult situation a meaning. And you might say, "Patrick, how can you say that I should give something terrible and challenging, like my mother, father, husband or wife being in intensive care, meaning? You must be right out of your mind." The fact of the matter is that whenever your critically ill loved one is in one of the following difficult, challenging, and often heartbreaking situations, where they are either very unstable and in a very critical condition, or they're in a life-threatening situation, or they're not waking up after an induced coma, or they're in intensive care for long-term treatments and long-term stays, including long-term ventilation, or they might be having a severe or traumatic head or brain injury, or your loved one may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order. Or your loved one may be in a situation where the intensive care team suggests a withdrawal of treatment or a limitation of treatment as being quote unquote in the best interest for your critically ill loved one. Or your loved one may even be approaching the end of life in intensive care. The most effective way to manage these challenging situations and face those challenges head on is to attach meaning to it. Your meaning. Not the intensive care team's meaning, your meaning. There's a big difference in you and your family attaching meaning to the critical illness of your loved one, or if you let the intensive care team attach and determine their meaning to it. The intensive care team's meaning of the situation is often negative, and it's driven by their often hidden agenda, because you simply don't know what you don't know. The fact of the matter is that there are so many things happening behind the scenes in intensive care that the intensive care team wants to control the meaning. However, if you want to make informed decisions, get peace of mind, control, power and influence quickly, you need to attach your meaning to this massive and unexpected, once-in-a-lifetime challenge that you know you can't afford to get wrong. One of the biggest distinctions between the 99% of the families of critically ill patients in intensive care who don't make informed decisions, who don't have peace of mind, don't have power, don't have control, and don't have influence, and between the 1% of the families of critically ill patients in intensive care who make informed decisions, who get peace of mind, have control, have power, and have influence, is that they accept whatever life is throwing at them. They make meaning out of the situation and accept it as a challenge that life has brought to them to test them of their strength and determination. Once you have decided that it is your meaning that counts the most, you will have a lot more bargaining and negotiation power when it comes to managing the intensive care team and getting what you want. It changes the dynamics completely once you have changed the meaning of the situation. Once you are no longer in a victim mentality and you assume responsibility for your thinking, the actions you are taking, the actions you are not taking, as well as the outcomes and results you are getting, you have transformed the situation into a situation that you are in control of. Most families that I have come across in my nearly 20 years experience in intensive care nursing in 3 different countries, where I literally worked with thousands of critically ill patients and their families, and where I also worked as a nurse unit manager in intensive care for more than 5 years, have clearly shown that the few families who give meaning to a situation where other people just throw up their hands and choose to be a victim of the situation have a clear and distinct advantage. By you and your family choosing to give meaning to the situation, you are taking charge and you are less vulnerable and susceptible to the negativity of the intensive care team, and you are less vulnerable and susceptible to the perceived power and the perceived authority of the intensive care team. You're also less susceptible to the agenda of the intensive care team, and the agenda of the intensive care team is often a direct result of what's happening behind the scenes in intensive care. By you making meaning out of this difficult and challenging situation, you stay in control of the situation and families in intensive care who are consciously giving meaning to this challenge have an edge. Full stop. Rather than you and your family drowning in self-pity or blaming other people, you are assuming control of the situation and families in intensive care who are consciously giving meaning to this challenge have an edge. Full stop. Rather than you and your family drowning in self-pity or blaming other people, you are assuming full control of the situation. You accept things as they are. You give it your meaning, and therefore you and your family are in a good position to make informed decisions, get peace of mind, control, power, and influence. By you making meaning out of the situation, you are 5 steps ahead of everybody else, and you are usually surprising the intensive care team as well. Again, you are way less susceptible to become a victim of the situation because you have changed the meaning. I'm also a big believer that things in life happen for a reason. There is no such thing as a coincidence. You watching this or listening to it is not a coincidence, because you are actively seeking for answers, and by you doing this, you are halfway there. No matter what life is throwing at you, when your loved one is critically ill in intensive care, give it a meaning that is important to you and your family. By you doing this, you will stay ahead of this challenge. So, how can you attach meaning to this situation whilst your loved one is critically ill in intensive care? Become the best advocate, make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence quickly when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again next week in another update. Make sure you also check out our Your Questions Answered section, where I answer your questions, or send me an email to support@intensivecarehotline.com with your questions. or you can call me. Find our international phone numbers on the Contacts tab. Also check out our ebook section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype or over the phone and via email by clicking on the email and phone counseling tabs on the top of the website. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll see you again next week in another update.